Welcome to Innovation Brief by IdeaScale, where we turn your work team into innovators.
Okay, so have you ever felt like we're just drowning in data in healthcare?
Oh, yeah, absolutely.
We're collecting tons of it. But then, are we really using it to improve how things work?
Yeah.
Especially, when it comes to patient care.
Yeah.
I mean, that's what matters most, right?
For sure.
So that's exactly what we're going to dig into today on the Duck Dive.
Right.
This whole idea of performance management in healthcare.
Yeah, it can be tricky.
Yeah, and we want to make sure that, everyone gets it.
Totally.
Not just what it is,
Yeah.
but why it really matters.
Right, because if you're aiming for excellence in healthcare, this is it.
This is it, yeah.
This is the foundation.
Absolutely. And it's not just about one little piece of the puzzle,
Yeah.
right? This affects everything from the top level goals of the organization
Exactly.
down to the day-to-day experience that patients have,
Right.
It affects how efficient teams are
Yeah.
and even how sustainable your organization is in the long
Oh,
term.
absolutely. Long-term thinking.
Yeah. So let's just jump right in.
Let's do it.
So first things first, when we say performance management in healthcare,
Right.
what are we actually talking about here?
So it's a process, right?
Okay.
It's not a one-time thing. It's continuous and it's all connected. Think of it like a flywheel,
Okay.
It's always turning, you start by figuring out where you want to go.
Right.
Like, what are your goals as an organization and
The big picture.
the big picture? And then you got to think about the level of care you want to be known for.
Right. The standard you want to set.
Exactly, the gold standard,
Yeah,
right?
yeah.
And then once you've got that vision, you got to put systems in place to track your progress.
Okay. So you're constantly checking.
Yeah, are we getting closer to those targets? And then this is the key. You use what you learn to actually make things better.
So it's not just about collecting data. It's about taking action.
Absolutely. It's a cycle. You set the direction, you check your course, and then you adjust, to make sure you reach that destination.
So it's more than just checking boxes to make sure you're following all the rules.
Way more. Okay.
Yeah, compliance is important,
Of course.
but it's like a side effect,
Yeah.
The real goal is to achieve what you set out to do and to make sure patients are getting the best possible care.
Right. So it's patient-centered.
Exactly, patient-centered. And there are a bunch of key pieces that fit together to make this whole thing work.
Okay. Lay it on me.
All right, so first, you absolutely got to have those super clear performance goals.
Okay.
Crystal clear,
I like that. Crystal clear.
and they can't just be these vague statements. They have to be tied directly to what your organization is all about.
It's mission.
It's mission, yeah.
Okay.
So instead of just saying, oh, we want to improve patient care, which everyone does.
Yeah, it's pretty broad.
Yeah, it's too broad.
Yeah.
A clear goal would be something like, we're going to reduce hospital readmissions
All right.
for heart failure patients by 15%,
Okay.
within the next year.
So it's specific. It's measurable.
Exactly. You got to
Okay.
be able to track it.
Okay, so we've got our targets.
Right.
What's next?
Now, this is where those KPIs come in. Okay, KPIs, key performance indicators.
Key performance indicators. Yeah, those are like your vital signs.
Okay.
They tell you if you're on the right track or not.
Okay, so what kind of things are we measuring?
So you've got your clinical quality measures.
Okay.
Like, are the treatments we're giving actually making people healthier?
Outcomes.
Outcomes, yeah. And then patient safety indicators.
So, are we preventing mistakes?
Exactly. Minimizing those preventable errors. Then you've got operational efficiency metrics.
Are we using our resources wisely?
Exactly. Are we doing things in a smart way? And of course, you got to keep an eye on the finances.
Right, the money.
The money. Yeah, you got to be fiscally responsible.
So basically, we need a really good system for keeping track of all this information.
Yeah, you need a system that can handle it.
Okay.
Because the data is going to be coming from everywhere. Your EHR system.
Electronic health records.
Yeah, administrative databases, patient surveys.
Indirect feedback.
Yeah, people telling you what they think, and of course, all those financial reports.
Then-
So much data, and the challenge is not just collecting it, but actually being able to analyze it.
Makes sense of it.
Yeah, to see the trends, to see what's working well, and to spot those areas that need attention.
And then once you've gone through all that data, what happens next?
You got to turn it into something useful,
Okay.
like reports and feedback that everyone can understand.
So not just a bunch of numbers on a spreadsheet.
No. It's got to be clear. It's got to be timely, and it's got to be actionable.
Okay.
So your leadership team can make good decisions.
Right.
Your clinicians and staff can see how their work is making a difference.
Yeah.
And even those regulatory folks,
They want to see what's going on.
they want to see that you're committed to quality.
It's like a story you're telling with the data.
It's a performance narrative.
I like that, a performance narrative. Okay, so it's not just about pointing out problems. It's also about celebrating the wins.
Oh, absolutely. You got to highlight what's going well.
Reinforce that.
Yeah, reinforce it because that helps you figure out what to do even better.
Okay, so that takes us to quality improvement.
Right to those QI initiatives.
Yeah. So when you see a problem in the data, how do you tackle it?
So you got to be systematic. You got to figure out why it's happening, you know.
Root cause analysis.
Root cause analysis. Yeah, get to the bottom of it. And then you got to make changes, you know.
Okay.
Maybe you redesign a process to make it more efficient, or you provide some specialized training to your staff, or maybe you start using some evidence-based practices, you know, stuff that's been proven to work.
So it's all about data-driven action.
Data-driven action, yeah.
But we can't forget about the people, right?
Oh, the human element is huge.
Yeah. So how does performance management address that side of things?
So employee performance management, that's a big piece of it.
Okay.
It's all about the contributions that individuals are making, you know?
Okay.
So you're giving regular feedback, you're doing performance appraisals that are more than just once a year, you know? And you're giving people opportunities to learn and grow.
Professional development.
Yeah, professional development. Because when your team is growing, they're going to provide better care, and the organization is going to do better overall.
It all ties together.
It's all connected.
Okay, so we've talked about the data. We've talked about the staff. What about the patients?
Oh, patient experience management. That's essential.
Okay, so how do we factor them into this whole evaluation process?
You got to actively ask for their feedback, and then you got to analyze it, you know?
Okay.
Use surveys, do interviews, find out what's working well from their perspective and where you can improve their experience.
So it's a two-way street.
Absolutely. It's got to be a loop.
Yeah.
You know, you're getting their input, and then you're using it to make things better.
So patient-centered care.
Patient-centered care all the way.
Okay, so it seems like performance management touches pretty much every part of a healthcare organization.
Every single part.
Okay, and how does it connect with things like risk management and patient safety?
Oh, it's tightly connected. When you're constantly monitoring performance, you're going to spot those potential risks early on.
So it's preventative.
It's preventative. You can put safeguards in place to prevent those bad events from happening.
Okay.
It's like building safety into the DNA of your organization.
Okay, so we keep coming back to this idea of continuous improvement.
Yeah.
How does performance management create that kind of culture?
It creates an environment where everyone is always looking for ways to do things better, you know?
Okay.
It becomes the norm
Okay.
because you're using data to make decisions, you're giving regular feedback, and you're empowering people to come up with solutions.
So it's a mindset shift.
It is. It's about shared ownership. You know,
Yeah.
everyone's working together to get better outcomes.
And in healthcare, where there's so many rules and regulations, performance management must be really important for staying compliant.
Oh, it's absolutely crucial.
Right.
It helps you track everything and prove that you're meeting those requirements. And it's not just about avoiding fines or penalties. You know, it's about showing that you're providing the best possible care and that you're operating with integrity.
So you're exceeding expectations.
You're going above and beyond.
Okay, so we've talked about what performance management is, but for a healthcare leader who's got a million things on their plate,
Right.
why should this be at the top of their to-do list?
Because it makes a huge difference.
In what ways?
Well, first of all, it's all about providing the best possible care to your patients.
Okay.
You're focusing on quality, you're focusing on safety, you're making sure they have a positive experience,
Right.
and that leads to better health outcomes.
Which is the ultimate goal.
It's what it's all about, right? Fewer complications, faster recoveries, a better experience for everyone.
I mean, that's what we all want, right?
That's the dream.
Okay, so beyond better patient care, what else does performance management do?
It makes your operations way more efficient.
Okay. How so?
When you're tracking how you're using resources and how work is flowing through the system, you can find those bottlenecks.
The things that slow things down.
Yeah, you streamline things, you figure out how to do more with what you've got.
So it's about working smarter, not harder.
Exactly. Especially these days, you know?
Yeah, resources are tight.
Resources are tight. You got to be smart.
Okay, so efficiency is key. What else?
It creates a culture of accountability and transparency
Okay.
because everyone knows what's expected of them, and you're openly tracking how you're doing against those goals.
Right.
It creates a shared sense of responsibility.
We're all in this together.
We're all in this together, and when you're transparent with the data, it builds trust.
Okay.
Trust with your staff, with your patients, with the whole community.
So it's about building relationships too.
Absolutely, it's all connected.
Okay, I mean, we talked about continuous improvement, but how does performance management actually make that happen?
It gives you the tools and the motivation.
Okay.
You're constantly monitoring, you're evaluating, you're giving feedback. So you're always finding those areas where you can improve. And then when someone figures out a great solution,
Okay.
you share it with everyone so everyone can benefit.
So it's about collaboration.
Big time collaboration and learning from each other.
So it's a win-win.
Win-win, yeah.
And when it comes to all those regulations,
Yeah, they're really
performance management helps you navigate that whole world, right?
Oh, it's essential. The
Right.
data is your proof that you're doing things the right way. It shows that you're meeting those standards
Okay.
and that you're committed to quality.
So it's peace of mind.
Peace of mind, yeah.
Okay, so all this data, it must be helpful for those big decisions that leadership has to make.
Oh, yeah, it's like gold for strategic planning.
Oh,
They can analyze the trends, see where the strengths and weaknesses are, understand what's working and what's not,
yeah.
and then they can make smarter decisions about where to invest resources,
Okay.
what services to develop, what direction the organization should be heading in.
So it's like having a roadmap.
It is. It's a data-driven roadmap.
Okay, so at the end of the day, how does all of this affect the people who matter most? The patients and the staff?
When you do performance management right,
Yeah.
everyone benefits.
Okay.
Patients get better care, and they have a better experience.
Right.
And when employees feel like their work is valued,
Yeah.
and that they have opportunities to grow, and that they're part of something special,
Yeah.
their morale goes up. They're more engaged, and they're more satisfied.
So it's a win-win all around.
Win-win for everyone.
Okay, so for those healthcare leaders who are listening, what are the key things they need to do to build a performance management system that really works?
All right. So number one, you got to have those clear, measurable goals.
The SMART goals.
Yeah, the SMART goals, and they got to be aligned with your mission.
Okay, we talked about that. What else?
You got to pick the right metrics, the right KPIs,
Right.
and you got to make sure you're covering all the bases.
So clinical stuff, operational stuff, financial stuff, and even employee engagement.
The whole picture. You got to measure it if you want to manage it.
What gets measured gets managed.
That's the saying.
Okay, so we've got our metrics. What then?
You got to have a good system for tracking everything.
Go ahead.
And you got to be looking at it regularly,
Regular checkups.
Yeah, regular checkups, use those data analytics tools.
Right.
Build some dashboards so you can see what's going on in real time.
Okay.
That way you can spot problems early on and find those opportunities.
So it's like a constant feedback loop.
It's like a continuous health check for your organization.
Okay, so we're constantly monitoring.
Yeah.
But what about feedback for the people?
Oh, that's crucial. You got to give regular constructive feedback
Okay.
and do performance reviews that are meaningful,
More than just a check in the box.
Way more. It should be an ongoing conversation
Okay.
focused on growth and development and celebrating those successes.
Okay, so it's about supporting people.
It's about investing in your people.
And part of that is providing training opportunities, right?
Absolutely. You got to invest in training and development programs that address those skill gaps,
Yeah.
Right.
Help people grow in their careers, and that's going to lead to better performance overall.
So it's a long-term investment.
It is. It pays off in the long run.
Okay. And what about recognizing good work?
Oh, you got to celebrate those wins.
Okay.
Have some recognition programs,
Right.
maybe even some incentives,
Okay.
It boosts morale, and it reinforces those good behaviors.
So it motivates people.
Oh, yeah, it keeps people engaged.
Okay, so this continuous improvement culture we keep talking about.
Yeah.
How do we make that happen?
You got to create an environment where people feel comfortable speaking up.
Okay.
They can share ideas. They can suggest solutions.
Okay.
They can talk about what they've learned, both the good and the bad.
So it's about open communication.
Open communication, yeah, and being willing to try new things.
Okay.
You got to encourage experimentation.
So it's about innovation.
Innovation, yeah, that's the key.
Okay. And I imagine leadership plays a big role in all of this.
Oh, leadership is essential.
They got to be on board. They got to be visible. They got to be supportive.
Okay.
And they got to hold people accountable.
At all levels.
At all levels. At all levels. Yeah, they got to walk the walk.
And throughout this whole process, we can't forget about the patient.
Never forget about the patient.
Okay, so how do we keep them front and center?
You got to be constantly asking for their feedback.
Okay.
And then you got to use that feedback to make decisions.
Okay.
That's how you make sure you're delivering value and meeting their needs.
Okay, so it's about putting the patient first.
Patient-centered care always.
Okay, and in healthcare, things are always changing.
Oh, yeah. It's a fast-paced world.
So how do we make sure our performance management system can keep up?
You got to be flexible.
Okay.
You got to be willing to adjust.
Okay.
New regulations come out, new technologies emerge. patient expectations change, you got to adapt.
So it's an ongoing process.
It's a journey, not a destination.
I like that. Okay, so just to recap, effective performance management in healthcare.
Yeah.
It's dynamic. It's got a lot of moving parts.
Yeah.
It does.
But it's absolutely essential
It is.
for achieving excellence in every aspect of healthcare,
Every aspect.
from patient care to efficiency to compliance.
It's the key.
It is the key. Okay, so for all those chief innovation officers, CEOs, directors, and tech leaders out there,
Right.
understanding and implementing these performance management principles
Yeah.
is not just a nice to have, it's a must have
Absolutely.
if you want to be successful and innovative.
It's the foundation.
It's the foundation. And if you're ready to take a deeper dive and discover how to turn your work team into innovators and really elevate your organization's performance,
Yeah.
book a demo for a free trial today at IdeaScale.com.
And join us every Tuesday and Friday
Right here on the Deep Dive by IdeaScale.
for more insights on innovation and all things healthcare.
And don't forget to subscribe so you don't miss any future episodes.
And leave us a comment below.
Yeah, let us know what you think.
We love hearing from you.
Thanks for joining us.
See you next time.